Welcome, everybody, and thank you for joining Bringing It All Together, our Chat with an Expert panel discussion. I'm going to just start with a little bit of quick housekeeping before we jump in. We are planning to have ample time to take your questions during this presentation, so please chat them into all panelists. Whenever you think of them throughout the presentation, we'll also prompt you a couple times in the chat to type them in, so please do that. Before we get started in the meat of our presentation, I just wanted to give a quick background to set the stage. So this webinar is following up from MCTAC and CTAC's Chat with an Expert initiative, in which we offered one-on-one consultation calls with our experts on leadership, human resources, and finance. And this provided an opportunity for children's providers to have these personal discussions about what they're experiencing and regarding their needs to address common business concerns that they're having or strategies that they wanted to implement. So the aim of this webinar is to focus on sharing a lot of those tips and takeaways that came out during those calls that could be useful for other providers to know as well. And also to, like I said before, answer more of your questions related to day-to-day operations, new program implementation, strategic initiatives, and planning. And with that, I am going to turn it over to MCTAC and CTAC's Boris Vilgorin, who's going to be moderating our panel today.
Great, thank you, Caitlin. Appreciate the intro. And also just to mention that this is being recorded and will be available. Just want to confirm that with you, Caitlin, correct?
Correct. This is being recorded and will be available on the CTAC website.
Yes, thank you. And I also want to just, and we'll say this numerous times throughout the presentation, but keep, encouraging, as Caitlin said, for folks to chat their question in. We really want to make this as interactive as possible. I am really grateful and thankful for our panel here of experts and the folks that really been doing all of this work with, and maybe even some of you who are joining us today, really talking to you directly, one-on-one, and also, hopefully you're able to join today. So today I'll do a quick intro, but really ask each panelist to really, when they talk, to introduce a little bit of themselves.
We can't. I'm sorry, Boris, we lost your audio.
I think we lost your audio. All right, so.
Fern?
Hi, everyone. I'm Fern Zagor. I am the owner of the Fern Zagor Consulting LLC, but I have over 40 years of experience in the behavioral health world, both with mental health, substance abuse, and integrated care with primary care, because I've had a lot of experience at an FQHC. Most recently, I was the CEO of the Staten Island Mental Health Society and brought the society through a very robust and very successful merger with our local hospital. At the end of the day, all of the programs survived and all the staff had jobs. It was a very, very good process. I'm pleased to be here. Ro?
Hi, I'm Ro Balfini. I'm the former Chief Administrative Officer of Staten Island Mental Health Society, and I was, along with Fern, helped the whole merger process into completion.
Right. Can folks hear me now?
Yes.
All right, excellent. I'm so sorry, not sure what happened, but somehow my audio disconnected and then video went. But I'm glad that you guys jumped in and introduced yourself. Really appreciate that, and sorry to everybody for losing my audio. Let's just jump right into some of the questions we prepared. But again, I really would encourage folks to chat the questions in as we go, because we really want to make this an interactive discussion. So just starting from the top, what tips would you give providers for determining, their concerns or questions or crystallizing it? I know, when we talked, you got, one of the things that I know we heard from all of the experts that are on the panel here today, is really trying to first get down to what are some of the, issues or concerns that providers were talking to you and being able to fully understand what was being conveyed to you. So maybe we can start with Fern first, and then we can go to David, followed by Barbara, and then Ro, if that's okay. So Fern, your thoughts on this?
Well, first of all, I absolutely enjoyed speaking with a number of people that I spoke to at the agency. Everyone had given a tremendous amount of thought and preparation prior to our discussion, and we made really very good use of those 30 minutes and covered an awful lot of areas. It's hard to believe that so much could be squeezed into a 30-minute period of time. So that was a very good experience for me, and I hope for the others as well. I think the tips and the areas of concern that I heard from the majority of people is that the designated services for children were, for the most part, new. If they weren't new, if the prior programs, the HCBS, the waiver programs, if they had been providing that, now they're providing services in a different way and having to build differently and help their staff move into this new world differently. I think the most important tip that I gave, and was across the board, it was to take it slow. Most of the agencies that I saw just were jumping in with full effort. Many hired staff before they had an infrastructure in place, before they knew where their referrals were coming from. So they committed to staffing, and they committed to goals and deliverables before they had built in the kind of infrastructure that they needed. So I think the most important tip was to take it slow and build it slow.
Yeah.
So
maybe
I'll stop there.
No, thank you, Fern. So before we go to David, and that's an excellent tip, and thank you. But I think one of the things I know we noticed is, clearly folks could have multiple issues at the same time, right? And I know this particular project, had limited time that you could spend, and really the goal was to try to focus on one or two elements. And I know, we talked about it, and I think the first step, and correct me if I'm wrong, was even trying for some individuals who were calling in, trying to even pinpoint what are specific issues they're conveying to you, right? Because sometimes it's HR, sometimes it's, leadership, sometimes it's finance, sometimes it's all of the things, right? I think, going slow makes total sense. But also I think, just like when we talked about when you work with consumers, who come in, who have many different concerns, and, you start thinking about treatment plans and other types of, how do you handle this? I know we at CTEC and MICTEC always talk about, well, let's pick, one or two goals to start working on, right? And I always convey that to any business plan, right? If you try to solve all the issues at the same time, and, sometimes you might have to the best of your ability, but trying to focus on one. So, can you talk a little bit about your experience about how you worked with individuals on kind of narrowing those potential areas to talk to you about, and try to focus on that particular area?
There were categories of issues that I heard time and time again. So as I was speaking with folks from the agency, I was really asking. I started by asking. First, they explained their program and what their primary concerns were, and I asked, what hurts the most, what is of greatest concern that we can focus on, because the concept is, no matter what you focus on, it has antenna, it has tentacles, and that when you begin to zero in on a particular problem, you see all the related issues that come up, which extend then to the full operation. So the kinds of issues that I was hearing time and again that were initially brought, the categories were not getting enough referrals, one category. not having a strong enough infrastructure in the agency to support the work that they were doing, or the agency might not be familiar with these kinds of services. So that was the other. And the third category that I heard time and again was that staff, many of whom are family peers, had been working in a, I guess, comparatively unstructured way. You know, the documentation wasn't quite what the requirements are now. Billing, wasn't part of what they needed to do. So those operational pieces weren't in place or were a little bit confusing. So there were training issues, both for the staff as well as for the other members of the agency who might not be familiar with these processes. So it was really starting with what feels the most overwhelming or of greatest concern. And then from there, we were able to move past and look at all the areas that were impacted.
Gotcha. Thank you for that. David?
Sure. I think that I agree with Fern is that you focus on what's the most painful, but also what do you least understand. I mean, there's plenty of information out there, even about these services. There's companion guides, but a lot of times it's a focus on, what is it that you couldn't find out? What is it that you really couldn't figure out yourself, and why do you think it's most important in this context? And that's sort of, I think, you did your homework, you looked at what was available, you have your own resources in-house, and you sort of narrow down to, these are the questions we just don't feel comfortable answering ourselves. And a lot of conversation would be around, what are other people doing? What has your experience been? What do you find? So I think really not only what is painful, but what do you have the least expertise about, and why is it important in your thinking? And let's sort of dig in and focus on that. So that's sort of the process we went through to really, in a very short period of time, crystallize what was most important that we could address.
Got it. Thank you. And turning to Barbara.
Kind of go on the opposite side of where Fern and David were talking about, because I absolutely believe that planful, slower approach to strategy and development is important. But at the same time, these organizations are also experiencing high turnover and turnover with staff, especially in the health and human services world. So as you're taking a planful approach one way, you really are chasing your tail with staffing on the other side. So one of the things that we have met, I worked with a team who have met with some agencies through this project, and a lot of their questions are around how do we recruit and be strategic and a little bit more creative in our recruitment process. And also, what are some strategies to really, find the right talent that'll stay, and, what are some retention strategies? So I think it's an and both, being really planful on one side, but also being really agile so that you can, somehow get ahead of the churn that continues to happen, with in these industries, especially under, OMH, Children and Family Services, OPWDD worlds, and the highly regulated industries for positions that are not very highly compensated. Some people are competing with Target and Walmart and, fast food for positions. And so how do you attract somebody to work in a role that requires more skill and requires more attention to detail? Because we're working with families and people, and then also making sure that they're very engaged through that process, so they're retaining staff that can be very mission focused and very people centered.
Excellent. Thank you, Barbara. And Ro, your thoughts?
Hi, everyone. I dealt with a lot of different agencies that were really concerned about, reduced funding from state and what they could do about expanding finances and so on and so forth. So there were a lot of people who were looking to expand services so that they would get more revenue, or I tried to explain to them that first look upon what you already have, make sure that your revenue cycle is tight. In that manner, you're at least getting paid for everything for all the service you're actually providing. I think that most of the agencies I spoke to were doing a great job, but needed some focus on all the different parts of the revenue cycle.
That's really good. Thank you, folks. You know, I think, so like I said, we prepared a number of questions, and as kind of Fern indicated, as you focus on one issue, and I think all of our panelists kind of alluded to it as well, there's these tentacles that kind of start growing and intersect, and our questions, I think, are in a similar way. We ask one question, and even though we lined up with like 4 or 5 others, we start touching on all of the questions, because it's very hard to kind of, even in the Q&A section, of this to keep it very siloed, because things are so intertwined. So with that being said, I know some of you already talked about some of the areas that were presented as areas where providers were struggling with. If there's others, please feel free to add to this. But I guess the second question, or as a follow-up to this, what were some potential solutions or next steps to these concerns as you kind of dove into some of these conversations? Maybe even the providers were running by you and just wanted to get some feedback on their thinking, or you provided to the providers in some of these areas. So kind of thinking about, so we have these problems, what are some of the solutions? And again, I think some of you already started to touch on that a little bit. And I know some of you talked about it, and also if you can expand on how these solutions, even though it might be for one area, were potentially related to or helpful in other domains. So we're gonna switch around a little bit the order. So let's start with, let's go with David, followed by Fern, then Ro, and then Barbara.
Thanks, Boris.
Yeah.
The areas that I primarily addressed were probably similar a little bit to Fern and Ro. We did some conversations around revenue cycle management, and particularly for organizations who were new in the billing arena. We spoke to regulatory compliance and quality assurance, utilization management, we talked about the kind of infrastructure overlay that is necessary to be successful. We also focused a lot on the new Children's Family Treatment, CFTSS services, and concerns about financial sustainability. And really talking about the fact that some of the agencies were feeling that they just didn't have enough clients or enough individuals to serve to support the kind of infrastructure that was necessary to support these programs. So based upon the problem, there was obviously different solutions. I think that the revenue cycle management is, a bit more technical in terms of what a regulatory compliance, where to go to look for what regulatory compliance looks like, what revenue cycle might look at, some of the kind of reports that were necessary. I think something that overlaid all my conversations were, what is the data that you're gathering? How are you looking at it? How does it inform your decision making? And I think that those kind of ways of understanding your environment, understanding who you're serving, understanding what it costs to serve is just an extremely critical feedback metric for you moving forward. And as it relates to financial sustainability, we talked a lot about what Fern talked about. How do you start slowly? How do you access staff capacity and programs to help you support your build-up? How do you really best utilize your direct care capacity? How do you measure that? And how do you create a trajectory and a plan for moving forward? And if, in fact, at the end of the day, you don't have enough clients, how do you then go out to the community of providers and begin talking with other folks in your community who may be struggling similarly in some of these programs? And how do you engage other stakeholders in a conversation, referral sources, care coordination organizations, and really build, we think about infrastructure internal. Talk a bit more about how do you build an external infrastructure also to help you access resources, have conversations, coordinate care, eliminate duplication, and create an environment where everybody can be successful.
Excellent. Thank you.
So it's so interesting to hear you talk, David, because many of the issues that I heard were very similar. And I guess that's kind of reassuring, because it's telling us that there are issues across the board to be addressed by those providing the children's services, and they are addressable. There's a commonality, in the concerns that have been provided. I guess, for the most part, I talked about the buckets that I was hearing. They're all interconnected, so bucket might not be the right graphic to describe it, but there were, and for several people, we talked about going for the low-hanging fruit. How can you be successful as early on as possible? Where do you need to play? Where can you place your efforts so that you can both be successful, but also see where some of the gaps are, and do it in a way that doesn't create risk to you and your program and your agency. So, for instance, we talked about developing protocols internally for the agencies that were larger and have multiple services and multiple programs, perhaps multiple sites. Start there. You're offering these services. Sometimes for the first time, your agency is not familiar with these services. That's a good testing ground for how to make this all work before you're out there in the community and then finding problems. You want to be able to anticipate issues as best as you can. And one of the best ways, I thought, in talking with people, is to look inward before you look outward. And from there, to strengthen that infrastructure and develop policies and procedures that are familiar not only to your own staff, but to the other staff in the agency too, so that your program becomes part of the fabric of what the agency has to offer, and hopefully can be provided in a seamless kind of a way. Now, for reaching out to the community, look, that's just to take a step back. You're marketing within your community, within your own agency, right, when you're doing that. Sometimes you have to go from program to program and describe what you're doing. It's actually pretty complicated. And what I heard from many is how confused people were about the difference between the CFSTT services and the HCBS services. I know I stumbled over that, but
all good.
But that there's confusion. And agencies, when you're going out and talking to providers and offering services, they don't know what to pick. They don't even know what to ask for. So being clear about all of that, there was even a recommendation that you have a very simple flyer, and maybe OMH can help with this as well, a very simple flyer that lists the services for the CFTSS and for the HCBS, and differentiates it, and something that you can give to people. The other was, I heard from several about the difficulty in getting referrals. Now, we're in a very difficult time, with COVID. We're not reaching out in the ways that we have traditionally done in the past. We have to find new and unique ways of engaging with others and still provide our our services, what I heard from several people is that they made phone calls, they were on Zoom calls, there were some meetings, local meetings, community meetings, regional meetings, and they talked about the services they had to offer, and there were no bites. People weren't interested, there were no referrals. And as we began to talk, began to think about how do you help those who are seeking service identify what their actual needs are, to articulate their needs, because sometimes people don't know. For instance, in the school system, the schools are, which is a standard place to go and to look for referrals. Several people I spoke to said, well, I called the principal, I called the parent coordinator, I called whomever, and they said, thank you very much, goodbye. The suggestion was really to make a connection with those people and find out where they are hurting. And when you understand what they're experiencing, where their hurt is, then you can offer solutions to them through the programs that you have to offer and be able to tailor it so it's meaningful. The initial response from many agencies is, I have enough to deal with, I have to think about your services too. You know, this way you make it more relevant to what they're experiencing and what they need. And then the other category, I'm sort of throwing everything in at this point, is that some of the providers I spoke with were either in communities where there were so many providers who had been designated that they were kind of tripping over one another, and or they're covering humongous areas, multiple counties, and trying to figure out how to manage all of that. And so we began to talk about how do you coordinate, you know, just as David had said, how do you coordinate with some of the other providers and maybe develop your own areas of specialty or your own geographic areas, or somehow work together so that everybody benefits and is not tripping over one another.
That's great. Thank you, Fern. I think when you talk about referrals, I always, and especially when I talk to clinicians and try to convey one of the messages you were just saying, I always tell them, think about person-centered and family-driven. When you talk to your consumers, you always want to meet them where they are, and you want to find out what their needs are.
Mm-hmm.
And to me, marketing and referrals follow exactly the same footsteps, right? I mean, that's it. You know, when I was listening to you and you were saying, ask them what, you know, their pain points and where they are and how you can help them. To me, there's really not much of a difference, and of course, very high level of person-centered and family-driven. You're just doing it with a referral source rather than with a family or a youth or, you know, a child, you know, that's in front of you. So it's you know, I think, you know, I always say that folks who do this work on the ground actually have, you know, an extraordinary skills when it comes to marketing. It's just how do you translate your, you know, quote unquote clinical skills or engagement skills or recovery skills to being more on the business side. We use different words, but at the end of the day, they're very similar, if not the same concepts. Yeah.
Good point.
Thank you. All right, now I don't remember who's next. Hopefully you guys paid attention to that. So I'll just say next.
Hi, the programs that I spoke to, they were more fiscal minded in terms of what they needed to do in order to make sure funding is available for them. So what I heard is a lot of concern regarding the transition to managed care, which has not come up yet. So a lot of agencies out there are concerned about how they're going to get paid for managed care, how they're going to transition. And my advice was to make sure that you have control over what you know in terms of the cost of providing the service. What does it cost you to deliver a service? If you know that, then you at least have the basis of what your needs are in order to be sustainable. That's what it concentrated on in terms of all different areas that provide services to children, because that is a big big concern. I also advise them to look into other areas that MCTAC has to offer in terms of their transition to managed care. That's basically what the few agencies that I spoke to, that's what their concern was. And how they take, the services they provide, how do they aim for in terms of productivity? How do they keep their clinicians accountable for productivity? How many services should they be providing? How do you engage clinicians to make them understand that if they have the time available to see other clients and how they see other clients, how do they calculate their own service menu so that they are providing the services that kids need as well as providing the funding that the agency needs.
That's great. Thank you. And Barbara, before you go, I mean, we're getting questions chatted in, so I really appreciate folks doing that, and we'll encourage folks to continue chatting them in. There are a couple of questions actually for you, Barbara, so I just want to take an opportunity. I think it's probably something you were going to talk about anyway, but actually one was, I'm interested to hear more from Barbara with some of her tips related to staff recruitment. And I think very similar, there was also about staff capacity, building, of course, staff capacity as well. So I'm pretty sure you probably were going to cover this, but just wanted to let you know we have a couple of questions there.
I'll try to cover a little bit in this answer, and I'm formulating it based on what Fern and you, Boris, had just said in relation to the work towards getting referrals and marketing. You can translate that very easily into recruitment. And you can translate that also into retention. So there's a couple of things when we're talking about recruitment. There were some questions, the themes that we saw was like recruitment, but also recruiting for diversity, which is a retention tool. It's also a recruitment tool. And then also training and professional development, which is capacity building. And that is a recruitment and retention tool too. And if we think about strategically, 2020 is a very different year for everybody. And there's nothing normal anymore, and we have to not use our normal processes that we have used in the past because they don't work, in this type of environment. You can't just put an ad in a newspaper or put a posting out on the internet and just hope that people will come. It's not the field of dreams, right? So we have to be a little bit more active in even looking for the talent to recruit, and just be a little bit more strategic and put on a marketing hat. And I love what Fern was saying is like, what's meaningful to the recipients of the services, and what's meaningful to the providers, and what's meaningful to the parents and the schools. But the other question is, what's meaningful to the people that we're trying to attract, and what's meaningful to the people that we want to retain? What's meaningful to the talent? Because if you maintain talent throughout for a few years, you're building the capacity because you're building the skills and the experience within that group. So how do you retain? And there's so many different things, like you can make sure that they're getting the basic training and requirements to being sure that they're meeting within compliance, and they're meeting within, program policies and procedures. But what other type of professional development opportunities are there? How can you create more capacity by allowing staff that it may not be in their position, but they may have an interest. And I can use this as an example of something that I saw working one time. A direct support professional had an interest in learning more about the financial and the business side of a residential service. And so the manager of the residential home said, well, here's half a budget. So you are in charge of managing the house budget and in terms of groceries and supplies. And that direct support professional learned a new skill that eventually allowed them to kind of traject into a supervisory role, where that platformed them and gave them the leg up when those openings happened, because they had a little bit of that experience, even though it wasn't in their current position. It was something that allowed them a little bit more capacity, so that people took more ownership over their jobs when they expressed an interest. The other thing is, when supervisors see some potential in employees, specifically employees that are showing a lot of engagement, a lot of, interest in something, capitalize on what they're strong in, and then also help develop them in things that they may have an interest in and they need a little bit more development. It's some sweat equity. I worry about everybody's budget. There's not a ton of money for, formalized training, but these on-the-job training opportunities with a supervisor or a manager or any other type of leader taking a vested interest in somebody and shadowing and creating these other opportunities can create more capacity and can create longevity and retention. So it's really about what's meaningful to the employees, and then also kind of marketing on that and capitalizing that and displaying the culture when you're out and being a little bit more aggressive in your recruitment strategies. One of the people that I was speaking with in our group had staffing shortages in the North Country. But I had just come back from the North Country, just back from the Adirondacks, and saw that all these people are out of work from the hospitality industry. And these are people that have great customer service skills, people skills. And, that may be something to partner with a chamber of commerce with to see if, people who are out of work may want to try a different career, and something that, there's really a lot of mission driven and you really can see an impact in people's lives in a different way. And, so there's some, just being really creative. I love doing everything with zero to no money or zero to little bit of money, having worked in the not-for-profit sector, and just thinking, how can we do this in a way that just takes a little extra time and effort, but for a lot of reward and impact without spending a ton of money. You can do marketing. If anybody has MS Word or PowerPoint, you can create a flyer. So there's just different ways to be really creative around this. And I think that if you're doing that, if you're marketing your business that way and your services that way, you could also market it for employees that way as well.
That's great. Thank you. So as I mentioned, we did get a couple of questions. Just want to be mindful of time and give an opportunity for those questions to be asked as well. So maybe I can turn to Yvette, who's one of our colleagues here at CTAC and MIGTAC, to maybe go through a couple of questions. And if we have time, we'll go back to a couple of our questions at the end. So Yvette?
Definitely, sure. Yeah, we do have a number of questions coming in. There is a question here around how would you propose leveraging boards and the resources that they can offer? And so someone is wondering how you could utilize them in kind of, again, building all the necessary components of a new service delivery.
So maybe we'll start with Fern this time again and about the boards, and then go to Ro, Barbara, and David.
Okay. It's fun to mix it up, right?
Yeah, exactly.
Boards are really critical for all the services and for the agencies. We don't often, at a program, and many of the program directors that I spoke with did not have direct contact with the board. And that was an issue because, these are essential services that have been brought into the agency. As I said earlier, you try to make it seamless, but it's also, I'm going to back up just a little. One of the things that I didn't say before, but I think it fits in well here, is that I found myself time and again talking about the need for strategic planning, to see the services within a larger picture, and to be able to plan not just for right now, but what will it look like and what should it look like 6 months from now, a year from now, 2 years from now, to begin to think longer term. And that is directly connected with the responsibilities of the board and the input of the board as well. Having that strategic planning approach. Now, the board members are usually residents of the community. So the more they know about the services that are being provided, they become ambassadors, as well as others do too. But they're in a particular position as as members of the board to be an ambassador for the agency and specifically for the programs that we're talking about. And they have access to people and community entities, agencies, others, faith-based community, the other provider communities, access that the program directors of the programs we're talking about might not have that access. And so informing and educating the board as well as other members in the agency, developing a strategic plan that everyone can buy into. Having buy-in from your agency is so important. I heard time and again from a number of the people that I spoke with is that they felt that they were functioning in a silo, separate from what the rest of the agency was doing, where there was a larger agency. And again, I suggested, recommended that they pull back and make sure that they've built the support of their leadership. And the board is part of that too.
Thank you. Ro?
In my experience with Staten Island Mental Health, and Fern did not mention this, but we had monthly meetings with our board, and part of those discussions included program directors. And there was an introduction to what that program director did. And as a matter of fact, we even had participants be part of a board meeting to just explain to them their experience in the services that we provided. So that's an idea that was really, really helpful, but because it did make that connection with the board and with the directors of the agency or the program directors themselves. And it enriched the board's involvement with what we are all doing. And I think it was a two-way street. You know, it gave the directors, the program directors, exposure to the board, so they knew each other. They knew that what was happening, and I think it was really, really good and healthy experience because the communication was there, and it was ongoing. Month to month, it was a different program director.
That's excellent. Thank you. Barbara? Yep.
I have to find my unmute. I think board development is important. I definitely agree with Fern and Ro. I also believe that board education is so important in creating ambassadorship. So very similarly, when earlier we were talking about sometimes internally staff are not really able to articulate what their services are, and externally, I think boards have a little bit of a harder time really understanding all the services and how they can leverage their network. And I think that if program directors is again, or bringing on some of the clients who receive services, and in addition to presentation to the board, it really helps them get engaged with the work that's happening. And it also allows some staff levels to really have an ability to connect with board members. I have worked in not-for-profit organizations where a board, even as a director, was just, you cannot talk to them. It's this secret entity that you only saw on a website. And then I've also, done consulting with not-for-profits where boards are very actively involved in the operations of the organization. But I think that what's most important is that, number one, that a board is engaged. It's not, it's more than somebody wanting to have a name on a website and build a resume. Somebody really should be an active participant in some way in advancing the priorities and the goals of the organization. And that could be creating committees. They don't have to necessarily be board committees, but they could be short-term strategic committees that could advance some priorities like recruitment, like financial, business development, anything like that, that can really, engage the expertise of the members of the board. Again, it's time, treasure, and talent. So, engage some of that talent in their time that can really help advance the organization.
Yeah, I'm not sure I can add too much more to how to leverage boards. I think that, boards are recruited to be really representative of the community that we serve and bring forward certain skill sets. So I think that it's important to understand, really the value that each board member brings to the organization, and to leverage that skill and that understanding of the community, as talked about the connections in the community, the understanding of the community, the needs of the community, how they may be different across different areas of the community, and really, we talked about how do you engage people, how do you bring them forward, identify their skills, and then use them. It would not be uncommon in my board is that we had a particular board member who really had a skill set and an understanding that was critical to a question that we had. I'd put a program director and a board member together and say, go up, work on this, So I think it's important. Everything that we talked about is critical, but really, truly, getting an engaged board, understand the skill sets and the connections they have in the community, then find ways to utilize that to the value of your staff and to the organization.
These are all very important tips when it comes to the board, and I think I see it, and I do some consultation across the country as well, and this concept of board and being able to use that skill set, as you kind of, David, just were talking about, and others, right? Education, but also learning about the skill set and understanding how they could be helpful, and then also thinking about from board development on the other end, what types of board members you might need, right? So if you are thinking about marketing, if you are thinking, or you having, financial questions or not clear, bringing some of those experts onto the board might be also helpful, because then you can work with those skills to move the organization forward. So I think one of the panelists said this, but it really is also a two-way street, because bringing those directors and others also gives that exposure. So I really appreciate those comments, and really good. So I think we might have time for one more question. I know we also had a question very specific about billing and codes, but I think at the end there was also a question about where do I find this information. I know Ro earlier on mentioned this. I do want to do a little self-promo here, but both CTEC and MIGTEC does a lot of training on billing and codes. So please make sure you look there. If you're specifically talking about Medicaid, I know Medicaid itself does some training, as well as ePaces. So I strongly recommend. We have tools like a billing tool on our website that actually dives into a code set. It was just initially enhanced, and just a couple of weeks ago, we put out 3 more tools on billing specifically. So I just wanted to cover that question as well. But as we wrap up, and this is kind of the ultimate question, I think, that to be asked, but if providers remember one thing from this webinar, what would you want it to be? And so keeping you guys on your toes, we're going to go with Barbara, Ro, Fern, and David. How about that? So one thing, Barbara, that you want folks to walk away with.
I think when it comes to recruiting and retention, is that, be as mindful for the staff that you're trying to attract and the staff that you're trying to retain as you would with clients that you're trying to serve. In people-centered organizations, sometimes we forget about the people that do the work, and they come a little bit second. And there is a philosophy in business that if you take care of your people, your employees first, it will show through customer service and retention of your customers. And so I think that is a translatable philosophy that can also work in the person-centered human services fields.
Excellent, thank you. Ro?
To add to what Barbara said, I think in terms of finance, communication is key. You cannot just be the finance person that's just adding numbers together. You need to get involved with the programs. You need to understand what numbers you are putting together, even when it's the revenue cycle. What is the whole process? you need to communicate, and that communication needs to be open. And so you have an understanding, a strong understanding of what you're providing.
Excellent, thank you. Fern?
Yeah, I think it really goes back to the first question, and that first major tip is really what I was hoping to leave people with, that you want to bring whatever the issues are down to a scalable, so that you can deal with it in a scalable way, that in a planful way, that you can, and that you can build, so that you don't have to get it all done all at once. And a lot of the people I spoke to just wanted to jump right in, and then we're feeling the repercussions of having done that. So it's the planning, it's that strategic planning process, that communication and coordination internally and externally.
Excellent, thank you. And David?
Sure. Everything that folks have mentioned so far, I think, is really critical. One of the things that I talk with people about, and it's something that Ro talked about, is that we can't manage in silos anymore. We really can't. I mean, we've seen that the environment changes rapidly. The challenges that we have increase exponentially. The risk that we face is growing. And we have to leverage, we talked about leveraging board, we have to leverage all the resources internally in our organization. And to Ro's point, finance can't be back in a corner running Excel spreadsheets and have the clinical staff, in a separate corner doing theirs. Clinical operations have to inform financial decisions inform clinical operations. And once we break down those silos and make decisions with an integration of each of those domains in our organization, the better decisions we're going to make and the more sustainable our programs are going to be and the better quality of services that we're going to provide. So that's my newest mantra right now, is that we can't operate in silos anymore. It doesn't work.
Excellent, thank you. And again, we talk a lot about integrated health, how you can't separate physical from mental health or substance use. It's the same thing here, right? You got to integrate all of your elements. You can't, operate clinical without finance. You can't operate it without HR, and the other way around. They all need each other, need to work together. So I just want to say thank you to all of our panelists for this discussion and their thoughts. I also want to mention we are putting together or have put together tip sheets in the 3 areas that we focused on today, and we'll be releasing those tip sheets as well. So I think, just again, just as a resource, there'll be the finance, leadership, and human resources. So you'll see some of the things we talked about in those tip sheets. So they'll be available, as we said before, this is being recorded and will be available as well. And as always, please, as I mentioned earlier, the various tools that we have on our website. And with that, I think, again, I'll just want to say thank you to all the attendees today for participating and joining us for this discussion. And thank you to our experts and panelists as well. And, and as you can see, we have some of the contact info. If you're interested in contacting any of our experts directly, please feel free to reach out and talk to them directly. So again, thank you everybody for this, and enjoy the rest of your day. Take care, everybody, and thank you.
Thank you.
Thank you,
Thanks,
everybody.
everyone.
Thank you, Boris.